Welcome. Welcome. It's so great to see so many people joining. Welcome to faculty and staff, parents, and members of our community. It's so great to see so many people joining us for this evening. Thank you to Ms. Forsberg for coordinating the setup of this evening's presentation. It's being recorded, so it will be available on our website as early as tomorrow, but possibly after the weekend. So there have been a lot of changes, lots of things happening. I'll give you just a very quick update as I understand it. And all of our updates this evening will focus on COVID, but as it relates to our schools. So I'll defer to the medical experts to speak about the medical component, but I certainly am able to speak about the impacts that COVID has had on our schools. So the numbers are obviously elevated. I believe that our county tripled what its previous high was. The hospitalizations are half of what the previous high was, or approximately half. So we're certainly seeing that decoupling. The numbers of cases in our schools are certainly high, and it's coming off the holiday break, but I just don't want to confuse high positivity numbers with high transmission rates. It's actually inversely related. They're not related at all. In terms of the high numbers, yes, many students in our school community, we've had several staff test positive for COVID, specifically from the time period right around Thanksgiving. And we're seeing a drop off at this point in terms of the number of COVID cases that we're being notified of and that we're aware of. However, although cases are high, transmission is very low. So what just the nuanced difference there is that if a student is positive, we generally can trace that in almost every instance to a source outside of the school, generally in the home, an exposure that took place outside of the school. There's very little evidence, if any, to suggest that there's any transmission happening within the school building. So I understand the numbers are concerning. I get that. But now that schools are opening, you're going to see the numbers go back down. And that's what we're already seeing. Schools are the safest place to be. Every medical expert, every medical entity and agency has reiterated that point. Schools are the safest place for children and for staff to be. And we're going to see the numbers go down. We'll see another uptick around the Super Bowl because that's another time for gathering. And then after that, if last year's trend holds true, we're going to notice a sharp decline later into the winter and certainly into the spring. So I spoke about cases because I've been receiving that question and there's been some confusion. High cases does not translate to high transmission in the schools. That's just not the case. And the evidence that we can point to, or one piece of evidence that we can point to, are the number of children who go out on quarantine and the number of children who are out on quarantine who actually become ill with COVID. And that's very, very low. And that is just one evidence that points to very, very low transmission rates in our schools. So I share that with you just because that has been a source of confusion, just the high numbers. Although our students, staff have tested positive, it doesn't translate into transmission within the schools. So where are we? Well, the Department of Health, state and county, have issued guidance. Interestingly, we had a Board of Education meeting Monday evening, and just prior to that meeting, the New York State Department of Health issued guidance to school districts, updating quarantines and isolation periods. And then the following day, the governor made an announcement about removing contact tracing or revamping the contact tracing system. And I was prepared to issue a letter to the community just saying I didn't have enough information at that point, because if we say that, okay, we're going to have contact tracing, and then at the next breath, we're going to eliminate contact tracing. Contact tracing has so many layers to it and so many roles to it. Quarantines are initiated as a result of the contact tracing that happens. So the two are so closely related that it's difficult to speak about one without speaking about the other. Removing contact tracing will have an impact. I don't know the extent of the impact, but it'll have an impact. on quarantines and quarantines being issued. And I just want to remind the community that the school district doesn't issue quarantines. Department of Health issues quarantines. So we can exclude the student from school based on a quarantine order and based on the quarantine rules. But I just want to confirm that it's the Department of Health that issues the quarantine. So I was prepared to send a letter to our community Wednesday afternoon, and then just before 5 p.m., the Westchester County Department of Health issued a letter where they clarified some of the state's positions on quarantines and isolation. So what we did was sift through all three, the press conference the governor held and what was said, what wasn't said, Monday and Wednesday's guidance from the state and county departments of health respectively. And we have such a great relationship with the county. They've been terrific to our schools. The Department of Health, the county executive, and his team have absolutely been terrific to our schools and have been great partners to us. So we thank them for the clarification that they issued Wednesday evening. It was quite helpful. With regard to, Tuesday evening. So in terms of quarantines, I just want to speak a moment about quarantines and contact tracing. I have been advocating to eliminate contact tracing. I've been now advocating to eliminate quarantines. I want the children in school. The children should be in school. School is the safest place for children to be. The data support that. And I'm not just referring to data on a statewide or a national landscape. I'm looking at Yorktown Central School District attendance data. And the data support that children should be in school. Schools are safe. Transmission is extremely low. I don't want to go out on a limb and say it's zero, but it's close to zero. It's low. It's low. There have been cases. I'm sure that there have been cases of transmission within the school, but when I think about the 7,000 quarantine absences that we had last year at our middle school and high school alone, and not even maybe one or two cases that we can trace back or that we can't trace back to outside of school transmission, the data in the Yorktown Central School District demonstrate that our schools are safe. So my struggle with the quarantines and understanding the quarantines is the message seems to be inconsistent. On one hand, we're saying our schools are safe, and I believe that. Like you, I send my children here to school every day, and I trust that they're safe. I believe in the steps we're taking. I believe in all the good work happening here and all the measures that we've taken. Our nurses have been spectacular, so attentive to every detail. Our principals have been nothing short of terrific in the work that they've done with contact tracing, and our assistant principals as well. So I believe in what's happening. So we believe the schools are safe. But on the one hand, if a student's exposed, the county and the state are telling them to stay home for 5 or 10 days because it's unsafe. I struggle with that inconsistency of message. Schools are safe. Transmission within schools are low. Children should be in school. So I have been advocating to eliminate quarantines, keep the children in school. They need to be here. They need to learn with their teachers, in class, in person. They need to be with their friends and just experience that joy of learning. So there has been some movement. The advocacy started months ago with the conversation about test to stay. I'll talk about that this evening and how our test to stay program will look. Subsequent to that, the state and county have issued reduced quarantine durations. So I'm going to go through in very brief detail. This will be recorded. We can post some content to our website to speak more about this. There are several charts that we've developed that will just be user-friendly in terms of following which situation and what the guidelines are for that situation. So quarantines. A quarantine is different from an isolation. A quarantine is if you're exposed. We all know what that is at this point. If you're exposed to somebody who's COVID positive, if you're fully vaccinated, and the DOH defines fully vaccinated as having 2 shots of a 2-dose vaccine, 1 shot of a 1-dose vaccine. The booster shot's not required to be considered fully vaccinated. So if you're fully vaccinated, and 2 weeks post the final dose, you do not need to quarantine upon exposure. As long as you maintain no symptoms and you're feeling okay, you get to come to school. There's no test to stay. Nothing changes for you. So that hasn't changed. That there's no difference from last week, 2 weeks ago, a month ago. That has been the protocol. Now, if somebody's not fully vaccinated, they don't have any of the doses, one dose, what the Department of Health says is that if you're exposed, you have two options. You can go out on quarantine, and it's a nuanced definition here. They say for 5 days, but it's not really 5 days because there's a day zero in there. And the State Department of Health defines day zero as the day that you were exposed to the COVID positive individual. That's day zero. And then you have to wait 5 days from there. And then on day 6, which is actually day 7, you get to return. So day 0 is the day that you're exposed. You're out days 1, 2, 3, 4, and 5. That's 6 days total, days 0, and then 1 through 5 make 6 days total. And then you can return on day 6, which for those who are counting carefully, it's the 7th day of return. So that's one option. Or you may test to stay in school. So we have a testing center on the Yorktown High School campus. So as soon as you enter the campus, there are these smaller buildings, these modular buildings on the right side of the driveway when you enter the high school campus. There's a big building, there's a building with a big sign marked Building B. I don't know how it came up with that name. It's been Building B since I arrived here, and we just refer to it as Building B affectionately. So it's Building B. It's a testing center for anyone who's been to any one of our testing clinics. It's Building B. You would just park right in front of the building between the hours of 7 and 8:30 a.m. on school days. You can come in for your test to stay. So you're notified that your child has been exposed to someone who's COVID positive. You then have two choices. You may decide to keep your child quarantined at home outside of school. They may return on day 6, which is actually 7 days from the exposure. Or you can participate in the test to stay program. If you participate in the test to stay program, your child doesn't have to miss school. They're not able to ride the school bus in the morning. They would have to come in here, get tested. If you bring them in early enough to get tested, then there's a possibility, depending on the start time of your school, as to whether they can ride the bus. But we'll be here from 7 to 8:30 a.m. testing. And if your child tests negative, they go to class. And there's a high likelihood that they're going to test negative. So they test negative, they go to class. If they test positive, they go home and they isolate, and we'll speak about isolation in a moment. So those are the two options that are available. The test to stay program is not available to individuals who are fully vaccinated. They don't have to test to stay. They get to come to school without performing the COVID tests. The test to stay is for individuals who aren't fully vaccinated. And so that's an option that's available. The testing is free. No appointment is necessary. However, if you're not on the test to stay list, you will not be tested. This is a new program for us. We have one person who is working the testing center for us, and will do a great job and has done a lot of testing for us already. But if you don't need an appointment, but if you're not on his list, you will not be tested. A consent form is necessary. We will not test your child unless you provide us consent. So there will be consent forms. We have the consent form on our website. We'll make sure that we put it in a very prominent place for our community to access. We will not test your child during the hours of 7 and 8:30 in the morning on school days for the test to stay program at Building B. It's only for students who are in the test to stay program from all 5 schools. And once your child tests negative, they're free to, at that point, ride the bus, and they're free to attend school that day. They would do that for 5 days after the exposure. And they can continue to attend school. And then once we get beyond that day 5, no more testing, the child just attends school as they normally would. Again, more information on the test to stay program. It was actually included in the letter that I sent home on Tuesday. It was a link within the text or the body of the letter that I sent with With regard to the test to stay, there are some limitations. As of right now, it's only for exposure that happens in school, that originates in school or on the school bus. And what I've shared is the vast majority of our quarantines have resulted from the school bus, cafeteria at lunch, more so at the middle school and high school, less at the elementary schools because we maintain the distancing, and then some small group spaces. In terms of just a few other pieces to this, the consent form has to be completed every day. Every time we test your child, we need a consent form. We're not going to have a standing consent order. So one time for one test, you need another consent form the following day. We understand the inconvenience, but we do believe that it's important for parents to consent each time we test their child. So let's talk about the test. What type of test is it? We're using, as of right now, we're using the Abbott Binax Now, which is a very shallow nasal swab. It goes about 3/4 of an inch through the nose, swirled around 5 times on one side, 5 times on the other side. We add the reagent into the Binax card, and then we'll wait for 15 minutes. You don't have to wait for 15 minutes at the test center. In fact, there would just be too many students there and too many people there at the test center. It's a very small location. It's got a big building B sign, but it's a small location. So once your child tests, the whole process will only take a couple of minutes to undergo the test. It's very quick. Then we'll call you back in 15 minutes with the results. So we don't want you to wait around for it. Come in, you're in and out. It's a 2-minute, it's maybe 2 minutes, maybe less than 2 minutes. It's a very, very quick process. So it's the Abbott Binax Now test that we're using. However, as we run out of those tests, and those tests are in short supply even for our school district, and we're a registered licensed laboratory. So the iHealth test is another test that we're using. However, it's still a very shallow nasal swab. It's maybe 3/4 to 1/4 of an inch depth. And again, very quick and very easy, similar process as the Binax Now. In terms of other test to stay pieces, the test to stay does not include after school activities. I disagree with that. I think it should include after school activities. The child may ride the bus home in the test to stay program, but they're not allowed to participate in after school athletics, after school clubs at the middle school and high school. I'm not understanding the logic. I'm seeking answers and clarification on that. The child tested negative. In our clubs, we exercise the same protocols as we do in school. Masks are required, the distancing is required. In fact, there are fewer students in clubs than there are in a cafeteria in a school. I'd love to give children the opportunity to continue in their after-school activities. So I'm hoping more to come on that, and I will keep you posted as I learn more. But for me, I'm just struggling to understand the rationale behind not allowing a child to participate in an after-school activity. Only school, then the bus home, and they may not participate in the after-school activity. Child tested negative. And as they progress through their test to stay protocol, they're going to be testing negative multiple times over the course of multiple days. I'm seeking answers. So as we get answers, I will follow back up with our community. In terms of quarantines, that's the extent of the information that I have at this time. There is some confusion about whether a student who is fully vaccinated but not boosted can participate in after-school clubs. They don't have to quarantine, they don't have to test to stay, but based on the latest guidance from the New York State Department of Health, we're being told that students may not participate. Fully vaccinated students who are not boosted may not participate in after-school clubs. That's another question that I have that I'm seeking clarification on. The County Department of Health is also seeking clarification from the state, and I anticipate we're going to get some clarification in the coming days. So again, more to come on that. But our goal remains. I think our collective goal as a community remains. We want our children in school. We want them in activities. We want them enjoying the school experience. And I can tell you that there are some days that we're literally working around the clock to get answers to make that happen. So that's the extent of the information that I have on quarantines. Children who are just not feeling well. There are other illnesses that are out there. Children who are just not feeling well, there's the sick day here or there. The test to stay is not for that purpose. The test to stay has a very limited focus. It's to prevent children from being at home with quarantines. So I just wanted to clarify that one point as well. In terms of now a student tests positive, so the quarantine, the student's exposed to someone who's COVID positive. In terms of quarantine, that term is called isolation. Not fond of the term isolation, but that's the term that's being used by the departments of health. So for consistency of language, I too am using that term, but I don't use that term with students. So the term isolation refers to someone who's tested positive for COVID. If someone has tested positive for COVID, the isolation period is it's essentially 6 days. Day 0 is the day that the individual tests positive or first becomes symptomatic. So that's day 0. Quarantine day 0 was a day of exposure. For isolation, which is COVID positive, it's a day that you either became COVID positive or the day that your symptoms began. And we're seeing, anecdotally, we're seeing very mild symptoms with students. We're seeing quite mild symptoms, everything from asymptomatic to congestion, head congestion, sore throat. Many of the symptoms that you hear the medical agencies refer to on the news. So day 0 is the day symptoms began or the positive test return. Sometimes the children are asymptomatic and all they have is a positive test, and they're testing, whether it's precautionary, whether it's they're visiting an elderly relative, or they just decided they wanted to take a test. So we're seeing that happen at times where children are asymptomatic. So day 0 would be that day that they test positive, then 5 days pass. Now on day 6, which is actually day 7, a lot has been made about, well, we're returning children after 5 days. Is that safe? I've received those questions. Is it safe? It's really not 5 days. It's really 7 days if we look at a calendar. It's being called 5 days, but I almost think that that's inaccurate to an extent, because there's a day 0 and then plus 5 days, you have 6 days, and the return is as early as that 7th day. So on that 7th day, the state refers to it as day 6. So you'll hear me say day 6. It's really the 7th day. I apologize for the confusion. That's just kind of the language that's been used by the Department of Health, and our language needs to really mirror that. So on the 7th day, day 6, child may return to school if they're fever-free for the last 24 hours without fever-reducing medications. And that's something that I'm just asking for our community to support that. If your child has a fever, please keep them home the extra day. Please keep them home. Please do not give them Motrin in the morning and send them in to school. The Motrin wears off around noon, and that's just something that's so avoidable, and that can result in quarantines. I don't anticipate that being any point of concern for us, but I'd be remiss if I didn't add it to this presentation. So fever-free for 24 hours without the use of fever-reducing medication. The symptoms have to be resolving. So you have to be feeling better. The congestion has to be resolving. The runny nose that's still running and they're blowing their nose several times an hour, that's not going to qualify for a return. It's not an automatic return. I also want to share that. It's not an automatic return on the 7th day, day 6. there's a checklist that we're developing and that we're working through that will assess symptomology to determine if the student's well enough to return to school. So it's not an automatic return, fever-free for 24 hours, symptoms resolving, a cough that's non-productive, a productive cough where there's mucus coming up and it's one of those heavy wet coughs that produces mucus, that's not going to qualify for a return. Now, if you don't return on day 6, does that mean you have to wait until the end of the isolation period, the end of the 10th day to return? No. When the symptoms resolve after day 6, you may return. So coughs can linger, we understand that, but we certainly want to include our nurses in that conversation so they can have that conversation with you. And I just want to put in a very quick word about our nurses because they have done such a remarkable job, and the return from isolation will take some time. We have a lot of students who are between day 6 and day 10 of their isolation period who want to come back. It is not an instant process. It's not an immediate process. Our nurses are assessing the symptoms of every single person who is out with COVID right now. That takes time. So we appreciate your patience. We ask for your patience and we appreciate it. It's a process. We're not going to return anyone early who's still not well. We're going to be very, very careful and make sure that we're extremely responsible, and our nurses can do that. We have the best of the best in our school nurses here, and they're just absolutely dynamite. And we'll consult with our medical director, who is absolutely dynamite, and we'll make determinations, but it's an individual determination. The quarantine piece was a little easier because it's not an individual symptomology. You're not assessing the cough or the symptoms or the fever of necessarily the individuals on quarantine. It's the children who have had COVID that we need to go through a more extensive process. So I appreciate your patience. That process does take a little bit of time. We have the same goal. We want all of our children back, but there are a fair number who are out with COVID who we need to review on a one-on-one basis, on an individual basis. And that's isolation. Isolation doesn't differentiate between vaccination status. Whether you have the vaccine, 1 dose, 2 doses, no doses, the rules are the same. So the rules are the same, and the isolation rules will be posted to our website as well so that it's there for our community to see. If you test positive for COVID, please know that you're not eligible for the Test to Stay program. The isolation period is that. It's the isolation period. It's day 0, and then day 1, 2, 3, 4, and 5. And then as soon as the 6th day, you may return, but the criteria have to be met. We're working on a form that will almost serve as I want to say an application for reentry, but it'll just help us to streamline our process so that we can move the return to schools a little faster and move those a little quicker. In terms of contact tracing, just a quick word about that. I know the state is changing their model for contact tracing. I understand that our role will be limited. The role of the school in contact tracing is going to decrease based on what I'm reading preliminarily from the State Department of Health. I don't know exactly what our rule would be, but I don't anticipate it will be a large role in quarantine. And I think the Department of Health is moving toward more of the individual reporting and having the parent report on behalf of their child, any close contacts or a positive test. If we're aware of a close contact that requires quarantine, we'll certainly act upon it. We'll certainly notify the families, offer the Test to Stay program, and hopefully keep every child in school. With regard to if there's a positive case, we're still reporting to the state any positive cases. Like I've said in the past, that state dashboard is not very accurate. It's actually quite inaccurate. Our own dashboard, which is why we created our own dashboard. As I was reviewing the state's dashboard, I noticed so many inaccuracies last school year And when you try to correct them, there's no mechanism to correct inaccurate data, or at least not one that I've discovered. So we created our own dashboard. It's on our homepage. It's broken down by school. You'll remember early last year and even toward the spring of the year prior, I would send out an email with every positive case. And what I heard is that it was getting overwhelming. The inboxes were flooded. It was just too much to manage. So we went the route of a dashboard. We thought that that would be an easier way for parents to go and take a look at trends, take a look at each school. You can look back as far as you'd like. I'm not quite sure how far it goes back, but it goes back quite some time. And you can assess the data for yourselves. So it's all up there. Every case that we're aware of. Now you may say, well, gee, that case looks low, or wait a minute, I know about this case and they just haven't told the school. We don't know every case. I wouldn't pretend to tell you that we know of every case that has happened in our school community. I don't think there's a school district out there that can know of every single case. But every case that we're aware of, and we are aware of the vast majority of cases, we certainly, and if a student's absent, we always follow up as well. But every case that we're aware of gets posted to our dashboard, gets reported to the state. So we'll continue to do that as well. Certainly at the elementary levels, if there's a case in the class or on a bus, we'll send you a letter to let you know that there was a case in the school or on the bus. And just be as transparent and as honest and forthcoming with the information that we have as we can. So just to summarize, and I think we're at the point where we're almost wrapping up, we are going forward with different activities. We're proud to be able to hold sporting events here. We're so happy to be able to hold performances. We had our in-person concerts, and that was terrific. And they were pretty well attended. We were pleased by the attendance for those events. We have dance company coming up. We have a winter formal Friday night, and we're looking forward to our students having a great time. But we're being safe and responsible at the same time. We're putting in our health and safety protocols. We're exercising as much caution, as much care as we possibly can. We're taking so many steps. I'm most proud of the ventilation in our schools. The ventilation is outstanding. It's second to none. The air changes in our classrooms are remarkable. Absolutely remarkable in terms of the ventilation in our classrooms. So I'm very proud of that effort. And that's something that's not overt. It's not something that calls too much attention to the fact that there's still illness out there and there's still COVID. And that's a very real part of our lives right now. So in terms of questions and answers, if you have any questions and answers, perhaps you came on hoping to take something away that I didn't address, there's a Q&A down on the bottom. So one question is asking about how many deaths of the virus. I'm not quite sure. I don't think any in this community, thankfully. But yeah, I'm not quite sure of the numbers on that on the national scale. And then there's some other mask quarantines. So opposed to the mask and quarantines, and I understand that, and I absolutely understand the concern with that. And we continue to advocate. There's a letter that several superintendents, including myself, have co-signed to advocate for a more pre-pandemic school experience. And I think that's everyone's goal, is to get to a more pre-pandemic school experience. So we are taking a great step in that direction in essentially eliminating quarantines. That's essentially what's happening here. So it happens on a rare instance on a bus or at lunch or in some kind of small group setting. We know that there's very little transmission in schools. I believe our schools are safe. So why not keep our children in school every day? So that's the Test to Stay program, essentially. That's essentially all the information that I wanted to share with you. I'm seeing some questions populate in the Q&A. What's the quarantine period for a student who leaves the country for vacation? Can they test to stay when they return? They can certainly test. I'm not quite sure what the rule on international travel is. I think there's a testing recommendation. I don't know if there is a testing mandate. So if your child is looking to be tested, please reach out to the school nurse to have that conversation about testing and testing frequency. We do have the ability to test here in our schools, and it's certainly available. One question is, why do you think the state changed the number of days from 10 to 5 or 6? From what I understand, based on the conversations that I've had with our medical director, is the incubation period is less. So with the initial strain, with the ancestral strain, the incubation period was up to 14 days. Apparently cases were developing within that time. With the subsequent strains, the incubation period was less, so 14 days went to 10 days. And now my understanding with the dominant variant is that the incubation period is just a matter of a few days. So if the illness is not manifesting itself at that point, the belief is that it won't, or the likelihood is that it won't. But again, that's probably a question that would be best reserved for the medical experts, but that's just my understanding based on my conversations. It's concerning that children are allowed back in the classroom with symptoms. Are they no longer contagious after a certain time? Based on what the CDC has said, the contagion is highest 2 days prior to the onset of symptoms, and then the first 3 days of symptoms being present. So it's that 5-day window, the 2 days prior, and then the 3 days after the onset of symptoms. So having children back into a classroom 6 days after the onset of symptoms or the exposure, or the positive test puts us outside of that window. But also, depending on the symptoms, the child may not be back on day 5, 6, depending on on day 6, how we look at that, or day 7. So much of it will be a function of how the child is feeling. Is the child well enough to come back? So one of the questions is, should we expect an uptick in high school cases following tomorrow's dance? I don't expect that to be the case. We have some protocols that are in place that I'm confident with, including every student testing prior to the event. So there are protocols in place, masking, the ventilation, the reduced capacity, the increased size of the dance floor, like I said, the home testing that went home with our students today, and certainly can go home with students tomorrow if they're in school. But we had many students pick up their tests today. So we're taking every step possible to ensure safety. So can we expect an uptick? I don't expect an uptick. I really do not expect an uptick. Now, there are other things happening this weekend. Could there be some other events, some other get-together, some other gathering? There are gatherings happening that I'm aware of throughout our community, throughout the county. And can that be the source of it? Of course, it's possible. And as we're aware of cases, the students go into a quarantine or an isolation, and we make sure that our schools remain safe. One of the questions I'm reading, if our child is sick, not with COVID, do they need to take a COVID test to come back to school? We require either a negative COVID test or some kind of letter from a doctor, something from a doctor indicating it's an alternate diagnosis. And it also depends on how long the symptoms lasted. So your child wakes up with a headache, they didn't sleep well the night before for whatever reason, and they're fine they don't come to school, they're fine by the afternoon. That's not necessarily a COVID diagnosis. That's not necessarily a run to the pediatrician. I would just encourage you to stay in touch with the school nurse and just explain the circumstances. And every circumstance is unique. So to paint a broad stroke on it would not necessarily be fully accurate, but do reach out to the school nurse, and the school nurse will be able to provide you with information. If the next question is, if a child is mandated to quarantine and opts out of the test to stay, are they still offered remote learning? Yes, they are. So if a child does have to quarantine or chooses to quarantine as opposed to the test to stay, remote learning remains an option. I'm not seeing any other Questions? I love this one. And I alluded to this earlier. I'm just going to read it directly. It says, I do hope that our school community, parents and guardians remember to be kind, patient, and respectful with our nurses and others who are tasked with communicating the changing guidelines. I really do appreciate that, because our school nurses are great people and our principals are great people who are tasked with an awful task of notifying people that they have to stay out of school, they have to quarantine, they've been exposed to someone who's positive, or sometimes if we perform the testing, that the child is positive. It's not a great feeling for our nurses or for our principals to do that. So thank you for that comment. It is much appreciated. They're not always met with the greatest kindness. So we'd appreciate that. And I'm sure they would too. Hardworking people with a really difficult and monumental task, and they've been brilliant these past 2 years. So, and the guidance change. They change at the drop of a hat. They change so quickly. We received 3 different pieces of information in less than 24 hours, and they didn't all align with each other. And so we're making sense of it. We're inquiring where we need further clarification and getting that further clarification. And as we get those answers, we'll communicate them back to our school community. If there's anything that changes our practice or our protocols, we'll certainly notify our community of that. So I'm not seeing any other questions emerge. So I think we'll end on that. So for our last commenter, thank you so much for including that. We appreciate that. Thank you so much. We appreciate you participating and for joining, taking time out of your evening. Thank you. Thank you. Have a great evening, and feel free to reach out if you have questions specific to your child and their health and their well-being. Our school nurses are available. If you have questions just in general on quarantine, visit our website first. There'll be some information posted there. And if it doesn't answer the question, please feel free to reach out to me or your child's principal. We'd be happy to help as well. Have a good evening, everyone, and thank you for joining.